Well, good afternoon, Prynhawn Da, and happy Sign Language Week. Thank you for joining me for what will be the last of my regular press conferences ahead of the Cynhadledd election. I'm really pleased and very grateful that we've had a BSL interpreter, Tony, and his colleagues at all of our press conferences during the pandemic. I'll be back myself to update you about the outcome of each of the 3 weekly reviews of the coronavirus regulations that we'll be holding between now and the 6th of May. Now, vaccination has been in the news a lot this week, so I wanted to begin today with an update on our programme, which has been protecting people against coronavirus at a record speed. As you'll see from the slide, more than 1.2 million people have already said yes to the vaccine, and we're making rapid progress, vaccinating people in priority groups 5 to 9. Almost 40% of people in their 50s and 62% of people in group 6, that's people with an underlying health condition, unpaid carers and so on, have had their first dose. And the slide demonstrates the great progress we are making in providing the second dose of the vaccine over the last month. The Welsh figures, you'll see them there in the green line, rapidly moving up the graph over recent weeks. More than 318,000 people in Wales have completed the full 2 doses of the vaccine, and we have the highest second dose vaccine rate in the UK. Indeed, over the last few days, we've been vaccinating more than 1% of the population of Wales every single day. And I think that's a remarkable testament to the hard work of hundreds of people across Wales working in more than 600 vaccine centres. And of course, as we've always said, we could do even more if we had more vaccine. Now, unfortunately, we know that there's been a delay in the supply of vaccines coming into the United Kingdom, a 4-week hold-up in a shipment of vaccines to the UK from India. Here in Wales, we are confident that no appointments for second doses will be cancelled, and all appointments for the rest of this month will be honoured. We'll then adjust our plans to make sure that we continue to invite as many people as possible for vaccination using all the different sources of vaccine. That's Pfizer, AstraZeneca, and from April, supplies of the Moderna vaccine. All of those that are available to us, we will be using every one of them to invite people for vaccination. I want to turn now for a moment to the issue of safety, because that's also been in the news this week. Now, it's very good news that the independent regulator, the MHRA, has confirmed that the benefits of the Oxford AstraZeneca vaccine in preventing COVID-19 far outweigh any risks. It has carried out a scientific review of all the available data, and the results do not suggest that blood clots in veins are caused by the AstraZeneca vaccine. The European Medicines Agency has also confirmed that the vaccine is safe and effective, and several European countries are restarting their programmes as a result. The MHRA said that people should come forward for vaccination when they are invited, and I strongly endorse that advice. Now, here in Wales, the overall public health situation remains stable at around 44 cases per 100,000 of the population and a positivity rate of 3.9%. We are, however, closely monitoring the situation in Ynys Môn and Merthyr Tydfil, where clusters of cases linked to the household and social mixing have driven up rates. We are particularly concerned about an apparent reluctance in some places to engage with contact tracing teams. That contact is vital. It's the way in which we identify the source of infection and how far it has spread. And the work of the TTP system becomes even more important as we start to relax restrictions. We have to act fast because the Kent variant is now the dominant form of the virus in Wales, and we know that it spreads very quickly. Now, we can only do that when we all help by cooperating with the contact tracing system as the law in Wales requires. So if you have symptoms, the advice is clear: isolate and arrange to get a test. If your test is positive, TTP will be in touch with you. Please work with them to keep yourself, your friends, and others safe from this awful virus. And if you are on a low income and have to self-isolate, financial support is available to help you through that period. And if you are, as I expect most of you will be, watching Wales play rugby this weekend, then please watch it with members of your household only. Surely the last thing we want to mark a potential Grand Slam weekend would be a legacy of a surge in coronavirus cases. As the public health situation improves, we are beginning to relax restrictions. On Monday, we will begin the process of opening non-essential retail, starting by lifting the restrictions on what those shops which are currently open can sell. Garden centres will also open from Monday. And if conditions remain positive, on March the 27th, we will lift stay local and begin the process of reopening our tourism sector, starting with self-contained accommodation and organised outdoor children's activities for the Easter holidays. And we're also looking to see if outdoor areas of some historic places and gardens can reopen to the public at the same time. We'll make a final decision on all of that next week in the light of the most up-to-date public health information. Today, we will publish an updated coronavirus control plan, which takes account of the positives of vaccination and the Kent variant, and will set out how we move through the alert levels. It's a plan to help us lift restrictions further, provided the virus remains under control, and it also sets out the areas which we will consider during the next 2 review cycles. On Tuesday of next week, we will mark the first anniversary of the pandemic. Our thoughts will naturally turn to the events of the last extraordinary year. And of course, we will think of all those families who have lost someone they loved to this cruel virus. But the anniversary is also an opportunity to look to the future. Wales after the pandemic will be different. I want it to be a place where everybody has a future in front of them, where all our young people, for example, have a good education and a job to look forward to. A Wales where no one is held back and no one is left behind. But this pandemic has laid bare the stubborn and deep-rooted inequalities in our society, and the future must also be one in which we do more to address those underlying causes. Yesterday, I met with our Disability Forum to discuss the impact of the pandemic on disabled people. We will set up a task force here in the Welsh Government to address the inequalities disabled people face, as highlighted in a report presented by that group to the Welsh Government. And next week, following the hard-hitting Ogbonna report of last year, we will publish the Race Equality Action Plan for consultation, setting out our aim of a truly anti-racist Wales. We're making changes today for a different, fairer future for us all. Thank you very much. Diolch o galon I chi gyd. I'll turn now to take questions, and as always, those answers will be broadcast live on all our social media channels. And the first this afternoon is to go to Teleri Glyn Jones at BBC Wales.
Rhan da, Prif Weinidog, diolch yn fawr iawn. Os gawn ni'r atebion yma yn Gymraeg ac yn Saesneg, os gwelwch yn dda. You told newyddion yesterday that those doses, those 250,000 doses, couldn't be lost without it having some impact. In what way will we see that impact? Is it on vaccine appointments, either for the top 9 or for those further down the list, or is it on your plans to ease restrictions?
Well, I think when you lose 250,000 doses of vaccine, we can't pretend that it has no effect at all. We are doing everything we can to mitigate the effect on appointments for people to get vaccinated. A number of different ways in which we are looking to do that. The fact that we are so advanced in our second doses will help us, because we'll be able to use Pfizer vaccine for first doses. In April, we've got the first modest, but the first supply of the Moderna vaccine. We'll deploy that, and every dose of vaccine that comes into Wales will go straight out to be used in the vaccination programme. So the very clever and successful people who've designed the programme so far are now looking at how we can continue to press ahead with the vaccination programme, despite the fact that those 250,000 doses are coming to us a month later than we had expected. It's not that they're not coming at all, it's just that they're coming 4 weeks later than originally anticipated. And of course, our ability to lift restrictions is linked to the success of our vaccination programme. So we will have to take that into account during the 3-week reviews. But our hope must be that we continue to see the position in Wales stable and reducing, and that we will continue to have the headroom to lift restrictions in the way that we hope. Wel, fel wedes I ddoe, pan chi'n colli 250,000 o doses o'r brechiad, mae hwnna yn mynd I cael effaith. Pobl sy'n redig ar raglen brechi sydd da ni, pobl sydd wedi wneud mewn ffordd mor llwyddiannus. Mae pethau ymarferol, mae nhw'n nawr yn cynllunio I ymdopi gyda'r sefyllfa newid. Dyn ni ddim wedi colli y doses I gyd o gwbl. Beth sy'n digwydd yw, mi'n mynd I cael nhw, ond mis ar ôl ble oeddwn ni'n disgwyl cael nhw I ddechrau. Ac wrth gwrs, y cynllun sydd da ni I leihau y cyfyngiadau sydd da ni ar hyn o bryd, mae hwnna yn dibynnu ar y llwyddiant o'r raglen brechi hefyd. So, bob tair wythnos, beth ni'n mynd I wneud yw beth ni'n mynd I wneud bob tro, ganolbwyntio ar y tystiolaeth a wneud y penderfyniadau sy'n addas I ni yng Nghymru mewn ffordd ofalus un cam ar y tro, ond ble mae lle da ni I wneud I cario mlaen I llacio y cyfyngiadau sydd da ni.
Diolch. And if we turn to Easter, you said you hope to be able to carry on with your plans for people to stay in self-catering accommodation and not to have to stay local. But when will people know for certain? When will you be able to confirm whether people can go on holiday at Easter?
Plan to confirm that by the end of this coming week. That will give us a further week's worth of data. Provided things continue as they are, stable and improving, then I'm hopeful that I'll be able to confirm that by the end of next week. But, as I've already said this afternoon, there are some parts of Wales where the position is not as good as we would like it to be, and people who follow the news will have seen that overnight Paris has gone back into a lockdown again. So we've known all along how fast circumstances can change in coronavirus, and that's why it's important to wait until the last moment you can in order to make these decisions, because that's where you have the best and latest data. So, y bwriad yw I wneud y penderfyniad cyn diwedd yr wythnos sydd I ddod gyda'r y data da ni ar y foment na. Ni'n neud e fel na achos mae pethau yng Nghymru ar hyn o bryd yn mynd yn y ffordd go iawn, ond mae pethau'n gallu newid mor gyflym yn cyd-destun coronavirus. Dyna pam ni'n mynd I aros am un wythnos arall a wneud y penderfyniad gyda'r y data, un wythnos arall o data I helpu ni I wneud y penderfyniad. Teleri, thank you to James Crichton-Smith at ITV Wales.
Thank you, First Minister. Are you considering limiting or holding back on lifting restrictions in places like Anglesey and Merthyr, given what we're seeing with case rates?
Well, my colleague Vaughan Gethin as the Health Minister and Julie James as the Local Government Minister met yesterday with both Anglesey Council and with the local authority in Merthyr Tydfil. We are talking with them about actions that we can take together to address the circumstances that they are facing, and we'll continue to do that into next week. There are more things we can do immediately, further testing, mobilising the resources we can provide to assist the Council, and that's the plan that we are embarked on at this point.
So to clarify, you've not ruled it out. And is there a risk that people are leaning too heavily on the vaccine instead of sticking to the rules?
Yes, James, I think that is a risk. People tell us that themselves, that when they've had the vaccine, they feel that it is safer for them to be able to resume, for example, indoor household meetings. Just have to ask people not to do that. You may have been vaccinated, but still most people in Wales have not been. And even when you have been vaccinated, it will take 3 weeks before you have any impact from it. The vaccine is not a silver bullet. It does not mean that people can behave in ways that create additional risk. And there is some worrying evidence that where we are seeing these additional flare-ups of the virus, it is because household mixing is resuming. Vaccination is not an excuse for doing that. And if we're not careful, it will lead to the sort of difficulties that we're seeing in 1 or 2 places. James, thank you. Draw I Thomas Evans, S4C.
Diolch yn fawr, Prif Weinidog, pnawn da chi. I ddilyn mlaen ar hynny, yn amlwg mae'r sefyllfa ym Merthyr Tydfil ac Ynys Môn yn un pryderus, so mae'n syliedig o'ch chi'n sôn am gymysgu rhwng aelwydydd. A fydd hyn felly'n cael effaith o unrhyw fath ar benderfyniad y Llywodraeth I lacio'r cyfyngiadau a'r gymysgu dan do yn benodol dros yr wythnosau sydd I ddod?
Wel, beth sy'n digwydd yn Merthyr Tydfil ac ar Ynys Môn yn dangos ble mae'r risg yn fwyaf yw pan ni'n gwrdd gyda bobl tu fewn. Ni wedi gwybod hynny dros misoedd nawr. Dyna pam ni'n dechrau I lacio cyfyngiadau trwy roi fwy o cyfleon I bobl I cwrdd tu allan. A mae hwnna'n mynd I fod yn wir trwy y proses o llacio cyfyngiadau, dwi'n meddwl, o hyn tan yr haf. So neges yw yr un neges ni wedi roi I bobl dros y flwyddyn bron diwetha. I cwrdd gyda bobl tu fas, mae hwnna'n lot yn saffach na cwrdd gyda bobl tu fewn. So, osgoi cwrdd â bobl dan do, tu fas o'r reoliadau ni wedi roi yn y gyfraith yma yng Nghymru. Thomas asking me whether the flare-ups we are seeing in Ynys Môn and Merthyr show further evidence that meeting people indoors is the most risky thing, and will that have an impact on our ability to resume meeting indoors? And I was simply saying that the evidence has been clear now for many months meeting people out of doors is a lot safer than meeting people indoors. That's why we have begun to lift the restrictions by allowing more opportunities for people to meet outdoors. And if people are tempted to meet indoors, the clear public health advice is don't do it. Because if you do, you're putting yourself, your family and others at far greater risk. And that basic truth of dealing with this virus, that it is safer to do things outdoors than indoors, will continue to be a principle that we will pursue through the whole process of lifting restrictions from today right through into the summer.
Diolch am hynny. Ac I fynd nôl at y sefyllfa'n Ffrainc hefyd, maen nhw'n pryderu yno am y posibilrwydd o drydedd ton o coronavirus. Pa mor debygol yw hi y byddwn ni yng Nghymru hefyd yn gweld trydydd ton? Ac ydych chi'n meddwl bod Cymru'n barod i ddelio gyda hynny?
Wel, beth mae'r Prif Swyddog Meddygol yn dweud ata fi yw mae'r drydydd ton yn dod ato ni. Nid os mae'n mynd i ddigwydd, y cwestiwn yw sut mae'n mynd i digwydd a sut ydyn ni'n mynd i ymdopi gyda'r drydydd ton. So mae lot o bethau ni'n gallu wneud dy gilydd i creu sefyllfa ble mae'r drydydd ton ddim yn mynd i cael yr un effaith ni wedi weld dros y Gaea ac yn y Gwanwyn yn y flwyddyn diwetha. So os ni'n gallu bwrw ymlaen gyda'r rhaglen brechu, os mae pobl yn cadw ar pethau fel pellter cymdeithasol ac yn y blaen, os mae'r drydydd ton yn dod, allwn ni ymdopi gyda'r effaith, ble ni ddim yn mynd i weld yr effaith ar y gwasanaeth iechyd genedlaethol enghraifft, ond ni wedi weld yn barod. So ni yn paratoi wrth cwrs tu fewn i'r Llywodraeth, a bydd hwnna tu ôl popeth ni'n mynd i wneud y cynllunio yn ystod y flwyddyn sydd i ddod. Thomas reflected on the fact that the events in Paris and in France are said to be evidence that a third wave is already emerging there, and was asking whether a third wave is likely here in Wales and how we would deal with it. So I was explaining that the Chief Medical Officer says to us that a third wave is very likely to happen here in Wales, and the question is not whether it will happen, it's how it will happen and how we will deal with it. And because there are new tools available to us, particularly vaccination, then that combined with people continuing to do all the things that we've learned to do, the social distancing, the hand washing and so on, that we would be able to cope with a third wave in a way that does not have the same impact as the second wave that we saw during the autumn and the winter, not having the same effect on our hospitals, not having the same effect on people falling ill. And of course, we continue to think about that, to prepare for it, and to factor it into all the decisions that we will make about the way in which restrictions in Wales can be eased over the weeks and months ahead. Thomas, diolch yn fawr. Over to Will Hayward at Wales Online.
Thank you very much, First Minister. Next week will mark a year since we first went into lockdown. Clearly, managing a pandemic is hard, especially with a new virus, because the science is still developing. However, reflection is a big, important part of learning from mistakes and holding people to account. What would you say are the biggest mistakes in the handling of the virus over the last year? And is there anything around testing, care homes, PPE, or the firebreak, for example, that you wish, on reflection, you had done differently?
Well, I don't use the word mistakes myself, because I think it's absolutely true that we should look back and learn the lessons, and I think it's undoubtedly true that if we knew at the start of the pandemic what we know 12 months on from it, some early decisions would have been made differently. So I'm sure that is the case, but it's not because mistakes were made. People were acting on the best understanding that we had of the circumstances that we are in. And many things have changed since then in our grasp of the virus, the way it behaves, the things that we can do to make things different. So I'll give you just one example. In the first wave, back in the spring of last year, I don't think we fully appreciated the significance of the way in which staff circulated between different care homes. So the standard model of care homes in Wales will be for, owners to have 2 or 3 care homes. So it's a small cottage industry in that way in Wales mostly. And the standard way of doing things would be the staff would circulate between them. Now, I think in the second wave, in the autumn, we had arranged with the sector that would be happening much less. And that's because we knew something 6 months on than we didn't know at the beginning. And I think that's just one example of the way in which, as we learn the lessons, so we have adapted our approach.
Thank you. The fall in cases in Wales has stalled over the last week, and we're still around 40 cases per 100,000. Though this is a great improvement on what we saw in January, it's still very high. Back in September, parts of Wales were going into local lockdowns when they were at lower levels than this. Can you explain why you think these numbers have stalled? Is it the local flare-ups that you've already identified? And has any particular measure you think had a role in stopping the decline in the virus in Wales?
Well, I think the overall Welsh figure is affected by the fact that numbers in North Wales continue to come down but slowly, and in those small number of authorities in Wales we've seen numbers heading back in the wrong direction. When you factor that into the overall Wales figure, then you do see that things have stalled at that rate per 100,000. We continue to make progress in relation to the positivity rate, so that's good, and we continue to see the numbers in our hospitals falling again this week. So I think there are explanations that are localised, and when you roll them up and put them into the all Wales figure, it means we're not making the progress at the Wales level that we were this time last week. Once we begin to lift the restrictions, then it is inevitable that the numbers will become more volatile. We've known that, and that is factored into our thinking.
Thank you.
Thanks very much, Will. Over to Thomas Davis at LBC.
Diolch yn fawr, Prif Weinidog. Can you tell us some more about the reluctance in some areas to engage with TTP? Is this exclusive to certain parts of Wales, or is it more widespread? And why do you think that's happening?
I don't think it's been a widespread phenomenon in Wales. Our TTP system has been very successful, and people have been very willing to cooperate with it. We've run it, as you know, as a public service, and we've run it locally, so that when you're talking to somebody, it's somebody who understands the part of Wales that you live in. And we've had fantastic cooperation on the whole. Just this week, we've had some evidence that in some places people are reluctant to cooperate. Now, there may be a number of reasons for that. I'm afraid it may be that they know that they've been doing things they shouldn't do, and they're not keen for that to come to the surface. I understand that for some people, being asked to self-isolate is a real challenge because of the financial burden of that, and that's why I was keen to emphasise in my opening statement that help is now available in Wales for people on low incomes who are asked to self-isolate. But whatever the reason behind it is not a sensible way of behaving, because it just means that the risk goes on for longer, and the risk has a much greater likelihood of getting out of control. When the phone goes from the TTP system, please take it seriously. It's there to protect you, and not cooperating with it puts you and other people that matter to you at risk.
Diolch yn fawr. Ac os gair ateb nesaf yn Gymraeg ac yn Saesneg, will the new control plan have proposed dates for the hospitality industry reopening?
Wel, wedais I wythnos diwetha am lletygarwch. Does dim cynllun da ni a hyn o bryd, ond yn yr ail ran o mis Ebrill, byddwn ni'n mynd i roi lletygarwch ar y bwrdd gyda nifer o pethau eraill i weld os allwn ni ddechrau y proses o ail agor lletygarwch tu fas yn y cam gynta. So mae'n yn y cynllun wrth cwrs, ond dwi wedi dweud yn barod pryd allwn ni ystyried yr achos I ail agor lletygarwch yn y cyd-destun bydd da ni ar y pryd. So Thomas just asking me about the reopening of hospitality and the control plan. It's in the control plan, of course, but I indicated a week ago when I took this press conference that in the middle of April, we will consider the first steps of reopening hospitality. It'll be the first steps. We'll start with outdoor hospitality, and of course it will depend upon the coronavirus context of the time, and that's weeks away from where we are. But the sector knows, I hope, I'm happy to repeat it again, that they will be on the table for consideration once we get past the 12th of April. Thomas, diolch yn fawr. Over to Rod Minchin at PA.
Good afternoon, First Minister. Are you concerned a third wave of COVID, such as what's happening in Paris at the moment, could lead to another national lockdown in Wales later this year?
Well, look, we are right to be concerned about that. I've never come to this podium and said to people in Wales that coronavirus is all over and it'll be completely behind us during this calendar year. I hope it will be. I absolutely hope it will be. But I don't think it's responsible to say to people that that's a guarantee that anybody could offer them. As things are improving. And our aim, of course, will be for things to go on improving and for us to be able to do more to restore freedoms to people over the weeks and months ahead. But coronavirus has been full of unpleasant surprises, just as we have seen in Paris over the last few days. You know, France doing incredibly well only a few weeks ago, and now finding a sudden and significant flare-up. Nobody should think that we are immune from that. Nobody should think we can drop our guard and plan on the basis that coronavirus has gone away. That will not be the approach taken by the Welsh Government.
Thank you. NHS waiting times in Wales were poor before the pandemic started 12 months ago. And now waiting times have got worse. What is the Welsh Government planning to do to try and reduce these waiting times?
The waiting times in the Welsh NHS in the month before coronavirus began were the best they had been for 5 years. So it's a myth to say that waiting times in Wales were poor before coronavirus started. We'd spent 5 years of really hard work and a lot of extra investment to get those waiting times coming down to the best they had been since 2014. But it is certainly true to say that here in Wales and everywhere else, waiting times have gone back up again because of the impact of the virus on the ability of the health service to do everything else we wanted to do. That's another reason why we have to stick to everything we're being asked to do. Otherwise, we will find hospitals full of coronavirus patients again, and those waiting times for everything else heading in the wrong direction. Services are already being restored across Wales as the number of patients in hospital goes down. And that's why it's such good news that they've gone down again significantly this week. We will have the greatest investment in restoring those services next year, because it's going to take investment in terms of money, in terms of the staff we've relied upon during this last 12 months who worked so hard, and in terms of making sure that we learn the lessons, the positive lessons from the pandemic, because we've learned to do things in the health service in ways that would have been unimaginable at the speed they've changed only this time last year. So we've got to take the positive lessons, we've got to invest in the future, and then we will be able to restore the health service to the very promising place it had reached in Wales just before the pandemic hit. Rod, thank you very much. Draw I Owain Evans, newyddion.
Diolch, Prif Weinidog. Un cwestiwn sydd gyda fi. Yn dilyn pryder am ddiogelwch brechlyn AstraZeneca yr wythnos hon, ni wedi clywed am rai yn canslo apwyntiadau brechu. Ydych chi wedi clywed am hynny Ydy rhywbeth sy'n eich poeni chi, a beth yw eich neges chi ynglyn â hynny?
Wel, dwi wedi clywed un neu dau bobl yn ddweud, maen nhw wedi weld bobl yn canslo y pwyntiadau, ond oedd hwnna ar ddechrau'r wythnos. Y ffigurau sydd da ni heddi, ni wedi cyhoeddi y ffigurau beth i hanner awr diwetha, mae'r ffigurau yn wych unwaith eto. 38,000 o bobl wedi cael y brechlyn ddoe, a mae hwnna'n ffigwr right ar ben y restr am un diwrnod yn ystod y raglen brechu i gyd. So y neges yw i unrhyw person sy'n becso, beth mae'r MARHA yma yn y Denis Unedig wedi ddweud, beth mae'r ansantaeth yn Ewrop wedi ddweud, mae'r brechlyn AstraZeneca, mae'n saff, mae'n effeithiol, a mae'n wneud lot fwy i chi na peidio cael y brechlyn o gwbl. So Owen was asking me about any evidence that people in Wales have been hesitant to come forward for vaccination because of the safety concerns that were being expressed earlier this week. And I did see a few reports that suggested that there had been some cancellations, but that position has not been sustained during the week. We've just published, while I've been here, the overall increase in the number of people vaccinated yesterday, 38,511, and that's right at the top of the list for the number of people we've managed to vaccinate in a single day. So any hesitancy that there was there does seem to have evaporated quite quickly as the evidence of the safety of the vaccine has come through strongly. And Owen asked me what my message to people in Wales would be about the safety of the vaccine, and it's just to say the MHRA in this country, the European Medicines Agency, both have confirmed the vaccine, the AstraZeneca Oxford vaccine, it is safe, it is effective, and you certainly protect yourself far more by having it than not having it. So if you're invited to come for a vaccination appointment, please make sure you take it up. Owen, diolch yn fawr. Over to Rob Taylor at wrexham.com.
Good afternoon. Flintshire Council say they anticipate the Deeside Leisure Centre could be returned to them by the summer. Are the Field or Rainbow Hospital facilities set to be released back to owners over the summer, or is there any intent to hold them through the year with concerns about what's to come in winter?
So the number of people in field hospitals, Rob, has been reducing over the last 2 weeks. When I last saw figures, which was Tuesday of this week, it was down to just over 100. And the use of field hospitals in different parts of Wales was reducing. So as the number of people in conventional hospital beds with coronavirus falls, so the need for field hospitals does reduce. I don't think we will expect to put all our field hospitals completely out of commission. We will want to hold some certainly in reserve in case, thinking of questions we've had earlier this afternoon, a third wave does come our way and we need that capacity again. But as we did last year, we'll do that selectively and based on the best modelling we have, keeping only the capacity that we think we might need. That means we can release some facilities back for alternative uses, then that's what we'll do.
Thank you. And you've mentioned earlier, as things enter the pre-election period or PERDA, these briefings are scaling back. Many people have found them interesting and informative, and the pandemic is ongoing, and you could say we're at a critical stage with the unlocking and vaccination programme. What was the argument against continuing them with the likes of the CMO, NHS Chief Exec and others heading them up rather than yourself and ministers? And is this the right time for an information gap for the Welsh people?
Well, I'm very keen to avoid an information gap because I think you're right. You know, people have got a lot of information out of these events. As I said, when we complete the 3-week reviews, I will come back and take a press conference again because that's the point at which there is the most new news. If things change significantly during the period of PERDA, then we will definitely make sure that we put that into the public domain. You're right to say the Chief Executive, the Chief Medical Officer, they're not constrained in the way that politicians are. And if the need arises, then we will use the forums that we've had and make sure that we give people the information they need. Rob, thanks very much. Over to Alan Evans at Cynhadledd Online.
Thank you, First Minister. As it's your final pre-Grand Slam and pre-election press conference, I'd like to thank you and your team for allowing and enabling us all to ask questions on behalf of the people of Wales. Diolch yn fawr. The first question from me is, the First Minister has unveiled his election pledges. A lot of people running micro businesses will be hoping he pledges to ensure that those businesses who've not received any help will get something to keep them afloat. We still get emails from businesses a year on making pleas for us to ask the First Minister if he can do something. It's appreciated that the Welsh Government has provided the most generous package of business aid of any UK government. But what, if anything, can the First Minister and Welsh Government do now to help these remaining businesses which still have not received help?
Alan, first of all, thank you for what you said. As you know, we've made it a principle of these press conferences that anybody who wants to ask a question is invited to do so. And some of us were here, as you know, quite a long time last Friday because of that. But I'm very glad of that principle, and I'm very pleased indeed that we've been able to answer questions from Cynhadledd Online. So the final budget that was confirmed in the Senate last week has £200 million set aside in it for the new financial year and the new administration that will be elected on the 6th of May. And as some businesses are able to reopen, of course, we will want to concentrate the help that we have available on those who aren't able to trade and therefore need the help the most. We've never been able to say that we can reach every single business in every single circumstance. But our aim has always been to use our money to make good the gaps in the significant help that the UK government has provided. And that's what we will go on trying to do. And where there are examples, then we are always trying to think of ways in which we can provide assistance.
The Bureau Local has been a welcome addition to investigative journalism in the UK and is fighting to ensure local authorities are held to account and provide information when requested in relation to their use of public funds. They recently uncovered one council, Thurrock, which took out loans from 150 local authorities amounting to £1 billion. The council invested £400 million in one company which went into liquidation. Would the First Minister consider setting out or insisting on a strong template for local authority due diligence checks on companies who stand to benefit from investment of public money, given the probable financial crisis looming for local authorities post-COVID-19?
Well, I certainly agree that the proper use of public money is something that every public authority that has responsibility for spending it needs to take very seriously. I'm very proud of the fact that in the last year, we finally got a local government bill through the Senedd, which does improve the operation of our local authorities here in Wales. The first time in 20 years we've succeeded in legislating in that way. I'll take away the point, Alan, that you mentioned specifically, but I think I could genuinely say that the way in which we approach the use of public money here in Wales stands up to examination. In our TTP system, we have not awarded a single contract outside the public service, whereas across the border, 121 contracts have been awarded to private firms without a competition at all. Direct awards of contracts, and we've done our best to avoid that in Wales, because that way you don't get the transparency and you don't get the accountability, and you can end up in the sort of circumstance that Bureau Local has been uncovering. Alan, diolch yn fawr. Finally, today to Tom Magner at Carers World Live.
Thank you very much indeed, First Minister. A couple of questions, if I may, on the report of the Senedd Health, Social Care and Sport Committee's inquiry into the impact of COVID-19 just published this week. There are two key issues, it seems, on unpaid carers. Recommendation 11 covers the Social Services Wellbeing Wales Act. The committee asked that you urgently provide long-term sustainable streamlined funding to deliver essential services to unpaid carers. Given that the Act is little known across Wales since it came in 4.5 years ago, and with the time pressure of the Senedd elections ahead, do you regret not having provided this critical funding before?
Well, I think we have always provided funding to support the Social Services and Wellbeing Wales Act, Tom, and I think it is an act that is very well known amongst those people for whom it is particularly relevant. It's the law that underpins the operation of all our social services departments here in Wales. And in a decade of austerity, we have continued to support our local authorities and the social services departments that they run in a way that you would not find at all across our border. Do we wish we could do more? Of course we do. But our budgets reduce every single year. The budget we have for next year is 4% lower in real terms than it was 10 years ago. And I read a lot of committee reports, and they're very well argued and they make very powerful cases. They generally don't say, as governments have to say, if I'm going to spend more on that, I'm going to have to take it from somewhere else. And where would that money come from? That's the balancing act we always have to carry out. And when there's less money to use rather than more money to use, that balancing act gets more difficult every year.
Just moving on to my second question on the subject of money. Recommendation 14 of the report on support and funding for unpaid carers urges the Welsh Government to ensure there's no disproportionate impact on groups or communities, but there has in reality been such an impact. For example, the news during the pandemic of the effect on Black, Asian, minority ethnic people. How will you restore the equilibrium essential to all sections of the Welsh population? Thank you.
Well, thank you for that. As a final question today, it's a really important question. I was very keen in my last script for the press conference to emphasise, as I tried to at the end, the need to do exactly what you said, to think carefully as we move beyond the pandemic of those groups for whom this has been an even more difficult experience than the population at large. And I mentioned my meeting yesterday with the Disability Alliance, a very powerful meeting with direct testimony from people, many of whom I know will be part of the world that Carers World Live operates in, about the way the pandemic has impacted on them. And I'm really grateful to them for the fact that they've got together, they've produced a report, they've identified the things that they think are most urgent to be getting on with, just as the Race Equality Action Plan next week will try to do the same in relation to the experience of Black, Asian and minority ethnic communities. I say, and I say it regularly, and I've said it here before, I expect, that as we move beyond the pandemic, my ambition would be to build back fairer. Because if it isn't fairer, it won't be better. And we want it to be better as well. But it won't be better unless we attend directly and carefully to the lived experience of people for whom the last 12 months has brought challenges, even beyond those which everybody living in this extraordinary year has had to deal with. And that's the way that I would like a future Welsh Government to respond to the reports we are now seeing, and in particular, the direct testimony of people whose lived experience of the last 12 months needs to be captured and put to work to make Wales a fairer place in the future. Thank you all very much indeed. Diolch yn fawr.